one of the many things that was talked about a lot after the federal budget passed was the impact on rural hospitals. Nevada has a lot of rural communities, obviously. Just overall, what is or isn't the impact on rural hospitals and medical facilities moving forward in Nevada?
Sure. Great question. I think the answer is to be determined. And so it's still a little early for us. Obviously, this is a monster bill. It's almost 1,000 pages. There's a lot of aspects to it. There's been a lot of analyses done and still many more that will be done. So we're still trying to figure out some of those things. There's a couple different aspects to the bill that concern us, and one that is, potentially positive for rural hospitals. So we're trying to see how those things will work together or won't work together.
So let's start with the positive. What have you seen so far that would be beneficial to medical services in rural Nevada?
Or there's a part of the bill that includes a brand new rural health transformation fund, where the Congress has set aside about $50 billion over 5 years to be distributed, we think, equally across all 50 states. And then that is a provision that the Senate Republicans included, recognizing that some of the cuts to Medicaid in the bill would put rural hospitals in a precarious position. And so that is their attempt to offset some of those losses or costs there.
What concerns you
About the
so
bill,
far? So far,
there's really two pieces to the bill that give hospitals a lot of concerns, particularly the rural hospitals. The first is the Medicaid work requirements piece, and certainly we understand some of the arguments in favor of that. The concern there is just what impact is that going to have on Nevada's uninsured rate? Nevada is historically one of the highest uninsured for health insurance coverage states across the country. And so, what is that going to do? We've seen a lot of projections that put about 100,000 Nevadans who are currently Medicaid recipients. That's the projection that would be taken off those Medicaid rolls if and when work requirements go into effect. And so that I think may be overstated a little bit. We're trying to do our best to see how that comes about. Will states have any flexibility in how they implement those rules? How is that going to work with the new Nevada Health Authority structure, with the implementation of the public option program here in the state? So there's a lot of factors there that are going to have an impact. We're just not sure. We can't definitively say this is how many folks will or won't qualify.
I remember a lot of the discussion at the legislative session, particularly from Democrats, but elsewhere as well, was the thought of all the cuts to Medicaid and how much Nevadans depend on Medicaid. Um, Now that it's happened, I realize that a lot of us are still digging through some of the nitty gritty details here, but how much is this going to be a challenge for healthcare providers and for patients to get what they need given these Medicaid cuts?
Another great question. I think it's still too early to tell. When we were discussing the potential cuts to Medicaid, based on some of those budget projections, some of the numbers the Republicans were trying to hit in February and March, when we were in the legislature and we had those hearings, I think the biggest concern was that the state's FMAP would get adjusted downward, particularly for the Medicaid expansion population. That didn't happen. And so that was kind of, in my mind, the doomsday. That would have been the really terrible aspect, the most significant cut to Medicaid. There's also, concerns at that time around block granting and some of those kind of things. None of that has come to fruition in this budget act. And so certainly not anywhere near as bad as what we were anticipating or what was potentially being talked about earlier this year. But there's going to be an impact. And so now we've got a couple of years to try to figure out what that's going to be and how to mitigate those cuts. The other aspect of the bill that concerns us is the cut to the private hospital provider fee program. The provider fee programs are something that 49 out of the 50 states in the country rely on. And so it's something Nevada only implemented in 2023. So we're only going to see a couple of years of net benefit to the hospitals that are able to partake in that program before that gets cut. That's another thing. Certainly, we've got a couple of years before some of these items get implemented. So we're going to have the midterm elections in 2026 before then. Right at the start of the provider fee program cut, you're going to have a new presidential election. And so there's going to be a new Congress, there's going to be a new administration. There's some time to work on these things and see if we can make them better.
This isn't meant to sound naive, but it does sound frustrating that whether it's big hospitals or rural hospitals and whatever it is, you have to base so much on, midterm elections and votes rather than just something that's a little more stable. But nonetheless, um, beyond the federal budget, you and I were talking before we started here. Just broadly, what's the state of affairs in rural Nevada for hospital and medical care? As you obviously know, it's been a challenge for a long time, just to even before this, to get services where they need to be.
Absolutely. You mentioned Tonopah earlier, and that's the only rural hospital in modern times that we've seen close in the state of Nevada. And now you look at that portion of the state on a map, and you see just what an empty hole in the middle of the state there is for folks needing care. And so certainly we have monitored that situation very closely over the last decade. A lot of those patients get transferred in many cases over to Bishop, California, where they are, of course, out of network with providers and those kind of things. And often that comes with air ambulance costs or ground ambulance costs that are significant. And so we've seen what happens to a community in that area when a hospital or rural hospital does close. Luckily, that's been the only one. I look at some other states now; they certainly have more rural hospitals than Nevada do, and so they can afford to lose sometimes, but we can't. We have 14 rural hospitals in the state. 13 of those are critical access hospitals, and we can't afford to see any of those close. Um, and at this point, I think our rural hospitals are doing very well. I think everybody is very stable and on solid financial ground currently. In the 2023 legislative session, legislators passed and Governor Lombardo signed a bill to provide cost-based outpatient reimbursement under Medicaid. And so that has helped shore up finances for a lot of our rural hospitals in the state. But now we're going to see in a couple of years what this bill will do to that. And so our concern, I think, right now is not so much that any of the rural hospitals are going to be forced into closure, but probably that service lines are going to have to be either frozen or cut back, scaled down. And so some of those things really concern us.
Because I would imagine it's not just a matter of open or closed in some cases. Obviously, Tonopah being what it is, but in other parts of Nevada. But it's staffing, it's the kind of care, prenatal care, whatever kind of care it is. Just because the hospital is open and they're doing all the work they can, presumably it doesn't necessarily mean it has what's needed in that community. So what's that gap between the needs of a rural community with fewer people and the ability of a hospital to meet that need?
Absolutely. No, that's a great point. Currently, we only have 3 of our critical access hospitals and only 4 rural hospitals in the state that still provide routine delivery and obstetric services. And so we have vast maternity deserts across the state of Nevada where pregnant women have to travel many miles in order to get prenatal care, delivery, and of course, postnatal. And so there's big concerns that some of those hospitals that are still providing that service and the challenges that they face in order to recruit the providers, in order to keep those doctors there, are significant. We're competing with 50 other states and trying to get the same limited number of doctors and nurses. And so it is a big challenge. Maternity OB services is one we really worry about. The other one I'd mention is long-term care. About half of our critical access hospitals provide long-term care services, and they're the only long-term care services in that community. So if those were forced to close or cut beds, in many cases, those long-term cares already have extensive wait lists. And so then you're thinking about these senior citizens that are needing to be placed in facilities either in Reno or in Las Vegas, and then what that does to the families who live in the rural community needing to pay for those things, and then also travel and do all the things it takes to provide that care.